Peripheral IVs are a common intervention we do to our patients, and it's probably important to know exactly what each type of IV can get us. So with that, I have created a table that is peripheral IV flow rates to gravity. Now, obviously, if you hang up to a pressure bag, these flow rates are going to be faster, but this kind of gives you a ballpark of what to expect. So if you're putting a 14 gauge in your patient as a peripheral IV, you're going to get about 250 mLs per minute, which means you can infuse a liter in 4 minutes. If you do a 16 gauge, it's going to drop down to 150 mLs per minute, which will get you about 1 liter in 7 minutes. If we drop down to an 18 gauge, which is now kind of a more common size we give in our patients, that's about 100 mLs per minute, which means you can get a liter in about 10 minutes. And then the next size down, which is probably the next most common in adult patients, is a 20 gauge, which will get you about 60 mLs per minute, which is the equivalent of 1 liter in 17 minutes. And then, of course, the smallest IVs, 22 gauge, 35 mLs per minute, which will get you about a liter in 29 minutes. So there you go. That's your flow rates to gravity of peripheral IVs. So when you wonder what size you should put in a patient, depends on the clinical situation and how fast you think you need to get your fluids in. Appreciate you guys tuning in. Please let me know your thoughts, comments, and questions. And until next time.